Good afternoon, everyone. This is my mother, Miss Devita Rana, and she had been diagnosed with lung cancer. She had symptoms of cough, and she was coughing for 4-5 months in Nepal, but we could not find a solution. So that's why we came to Medanta, because we heard that it was a very reputed hospital. And when we met with Randeep Guleria, he referred us to Dr. Harshvardhan. And after doing a PET scan and test, we got to know that she had a tumor. He looked at the PET scan, they were very efficient, and within an hour, he had already referred us to an oncologist who did 4 cycles of chemo, Dr. Ankur. And after doing 4 cycles, again, we went back to Dr. Harshvardhan, who explained us the whole process, the process of the surgery very well. He said it could be a keyhole surgery or it could also be an open surgery.
Today, the patient we are talking about is Mrs. Devita Rana. She was a patient from Nepal, very sweet lady. Unfortunately, she presented to us with the stage 2 lung cancer. So I'll tell you today what happens when a patient of lung cancer presents to us. Whenever a patient with suspicion of lung cancer presents to us, he may be carrying some reports, because we are a tertiary care center and we get referrals from almost all over the country and from outside the country also. So what we do in these patients, we order for some advanced tests like PET scan to see whether this lesion or the lung cancer is confined to one of the lobes, whole lung, or some else in the body. So to see whether it is a localized disease or a metastatic one, we have to do a PET scan first. And a very important test after the PET scan is a biopsy. So biopsy has to be performed so that your doctors can treat this lung cancer by different interventions. Now, what interventions we have? When a full workup of this patient or these patients are done, then a tumor board is formed, which consists of a radiation oncologist, a medical oncologist, a thoracic surgeon, a radiologist, and a pathologist. All of these qualified people to treat lung cancer sit on one table and discuss that case threadbare, and then make a personalized plan for that patient. This tumor board is very active in Medanta hospital, and we do it for all our lung cancer patients. So after the concentration by the tumor board, these patients are either taken up for chemotherapy, radiotherapy, targeted therapy, surgical therapy, and whenever the patients are for surgical therapy, they are referred to Institute of Chest Surgery. In Institute, we prepare these patients for surgery, and these days we do these surgeries by advanced methods like VATS and robotic surgery. Because these surgeries are done by 3 small holes in VATS and robotic, the patient gets into its normal work regimen within 1 week of getting these surgery done. So similarly happened with Mrs. Devita Rana, and she got a very nice surgery done, and she went back to Nepal without any trace of lung cancer, for which she came to us. Thanks a lot.
The day of the surgery, we were updated every hour of what was happening in the surgical room and during the operation. And my mother was very, very grateful for her experience in the ICU, because she said the doctors were on round every 2 minutes, and even though she could not speak and she was just whispering, the doctors and nurses took exceptionally good care of her and showed a lot of compassion and empathy. So we are very grateful to the whole team. After the surgery also, there was a nutritionist, there was physiotherapists who continuously made sure that my mother exercised. She cycled. They had a very nicely equipped gym room for her to exercise every 20-30 minutes, and all the nursing staff and all the doctors took very, very good care of her. So we are very grateful to Dr. Harshvardhan and his team of doctors, Dr. Arvind, who also came by and who made sure that we did not panic and who made us understand each and every process, however small that they did. So the whole team kept checking up on us, and even after my mother's discharge, the aftercare was also very good. And every 2-3 days they would see us and make sure that she was fine. And now finally we're going back to Nepal, and my mother is cancer free due to the effort of this whole hospital, and we are very thankful and grateful to the whole team. Thank you so much.